Hi, this is Tamara Ofner with the Business Critical SharePoint program. I'm here today with Mike Knutz from Aeturnum. Mike, thanks for being here.
Thanks, Tammy.
So let's jump right in and start talking about the fact that you have connected SharePoint with line of business systems for Moffitt Cancer Center, which is a nonprofit organization. It features the Southeast's largest blood and marrow transplant program and outpatient treatment program, and it has more than 300,000 visits a year. That's pretty big.
Yeah, it is. They do a lot of very good work, and their clients are their patients. And whether a patient is newly diagnosed, being treated, or in remission, cancer is very stressful. So Moffitt undertook an initiative to develop a secured patient portal to provide access to information for the patient about their care. Previously, patients had been doing general searches on their own about their condition and getting a wide range and at times inaccurate results when they're looking for information.
So how did you help them out with these problems they were facing?
Well, we, together with Moffitt, decided on an approach to start curating accurate information, looking at the data sources they had available internally, looking at publicly available sources, and to craft an approach to put that together and present it to the patients.
Okay, great. Well, that sounds like, especially for a cancer center, that's very important stuff. So how was the initial patient experience improved with your solution?
Well, it was really improved by being able to curate that information accurately and developing a taxonomy around the terms and how information is classified. Obviously cancer is a very complex subject, and the taxonomy becomes a critical element of how we know what we need to present. So something as simple as leukemia through the taxonomy is related as a different kind of blood cancer. So once the taxonomy has been established, what we've done is to use it and use the tools of Concept Searching, who's one of our partners, to manage the taxonomy and also classify information. As content is added to the SharePoint solution, that content is automatically meta tagged.
Okay.
So as new information is produced, there's no need to actually manually tag it.
Oh, wow.
And the content basis was extended, so we have video content available, we have physician biographies, we have articles, and we've also integrated external sources such as clinical trials and support groups from the National Cancer Society.
Okay, great. Do you have any specific examples you'd like to share of how the patient experience was improved?
Well, within that, one thing that was done was the use of proximity search. So if someone is looking for a support group, we give them information about the nearest ones to them. So doing mapping integrations as part of the solution.
That's great. Okay, cool. So could the same solution you used for Moffitt be used for, say, any other healthcare organization?
Yeah, you would want to basically work with them to define what their requirements on, what kind of experience they're trying to create, how do they want to serve their community and their patients. And it would even work if you're looking at someone who's a general care provider as opposed to something more disease-specific like cancer or diabetes.
Sure. So basically, you could take the concept and work with other customers to create a solution similar for them.
Yep, and there's even some similarity and crossover for health plan providers, because there's a lot of interest in doing wellness portals, because frankly it's almost better to have people not get sick than have to pay for their treatment.
Okay, great. Is there anything else you'd like to share about Moffitt that you think would be relevant?
No, I think that gives a pretty good summary of what we did and why it's been very successful for them.
All right, great. Well, can you let us know what the website is we can go to learn more about what you're working on?
There's a case study available about Moffitt, and it's www.aeturnum.com.
Okay, great. Well, thanks so much, Mike, for being here.
Thanks, Tammy.
This is Tamara Ofner. Please visit sharepoint.com/BCSP to learn more.